Why do prenatal genetic tests have false positives? Have you ever wondered why some prenatal genetic tests can show a positive result when everything is actually fine? This is a common concern for many expecting parents. Let's break down the reasons behind these false positive results in prenatal screening. Prenatal genetic tests, particularly non-invasive prenatal testing, analyze tiny fragments of fetal DNA found in the mother's blood. However, most of this DNA comes from the placenta, not the fetus itself. Sometimes, the placenta may have chromosomal differences that the baby does not have. This situation is known as confined placental mosaicism. When this happens, the test might indicate a genetic abnormality, leading to a false positive result. Another factor is the mother's own DNA. The blood sample used for testing contains both maternal and fetal DNA. If the mother has certain conditions, such as uterine fibroids or undiagnosed cancers, these can interfere with the test results. This interference can create misleading outcomes, which can be alarming for families. Biological events can also play a role. For instance, if a twin embryo stops developing early in pregnancy, this is called vanishing twin syndrome. The leftover DNA from the non-developing twin can remain in the mother's bloodstream and confuse the test results. Laboratory processing errors, while less common, can also contribute to false positives. These errors might occur during the handling or analysis of the samples, leading to incorrect results. Moreover, the rarity of the condition being screened can impact the likelihood of false positives. For very rare genetic disorders, even tests that are highly accurate can produce a higher number of false positives. This happens because the chance that a positive result is a true positive decreases when the condition is uncommon. Due to all these factors, a positive result from a non-invasive prenatal test is not a definitive diagnosis. It serves as a screening indication. To confirm whether the fetus truly has the suspected genetic condition, further diagnostic tests like chorionic villus sampling or amniocentesis are necessary. These tests analyze fetal cells directly, providing more accurate information. Understanding these aspects helps families and healthcare providers interpret prenatal screening results correctly. It is also a good idea to seek genetic counseling. This can help explain the meaning of test results, the risks of false positives, and the options available for confirmation and support.